Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi, and it's been a week of progress in the local and national push to roll out the COVID-19 vaccine. The White House announced it has secured an additional 200 million doses and anticipates to have enough vaccines for the vast majority of Americans by July. We had several days with cases under 1,000, but deaths are still relatively high. 178 were added to San Diego's total this week, and more vaccination sites are becoming available, including the Mar Fairgrounds this weekend. KPBS reporter John Carroll has more.
At a place known for horse racing and the annual San Diego County Fair, something new. On Friday, the Del Mar Fairgrounds will become a life-saving place when it becomes the county's latest vaccination superstation.
We really do believe it's important for our community to get vaccinated. The light at the end of the tunnel are the vaccines.
In the same vein as the UC San Diego Health County partnership at Petco, Scripps Health is now partnering with the county and the Del Mar Fairgrounds to open this vaccination superstation. As long as you fall into the tiers, healthcare workers and those 65 and older, you can get vaccinated.
It doesn't matter, frankly, whether or not you have insurance or not, or where you live within the county.
I just wanted to quickly update you on where we are in this pandemic.
Governor Newsom gave his update from the Fresno County Fairgrounds, which became a vaccination superstation last month. Newsom had good news when it comes to COVID in California.
A month ago today, we had 13.9% positivity rate here in the state of California. Today, we're down to 4.8%.
Newsom says 1 month ago, we reported nearly 50,000 cases on one day across the state. Today, that number stands at 8,400. The governor says we could be doing a lot more if not for one major problem.
We simply do not have the allocation that we need to get to the levels where we all need to go.
The statewide vaccine shortage reflected in San Diego County.
Unfortunately, we still don't have adequate doses from the federal and state government.
Newsom says the federal government is ramping up vaccine distribution, so more doses should be heading California's way in the coming weeks. The governor was heckled by protesters throughout the news conference who want him recalled. John Carroll, KPBS News.
While Del Mar might be the newest vaccine location, it's far from the only place available to San Diegans. We have a vaccination dashboard at kpbs.org where you can find a map of sites from North County to the South Bay. We're also tracking the progress toward getting our population vaccinated. You can get the vaccine dashboard through the Tracking COVID-19 link at kpbs.org. Some San Diegans are harder to reach than others, and that includes those experiencing homelessness. Service providers downtown are now administering vaccines. This is what it looked like this week at Father Joe's Villages, where about 200 shots were given out. They're following the same state guidelines limiting access to those 65 and older. Father Joe's will distribute vaccines every 2 weeks. Equity in access is an issue in many San Diego neighborhoods. KPBS reporter Max Rivlin-Nadler has this story from City Heights.
As vaccination superstations have opened downtown, in the South Bay and North County, City Heights and the rest of the Mid-City area remain without a major vaccination hub, instead relying on local providers to reach out to eligible residents. That's leaving people behind, says longtime City Heights resident Anna Daniels, who says it was her own privilege that made it possible for her to be vaccinated.
I'm a upper middle class white person with a car. I got my vaccine, Max. That should be no surprise. I am the low-hanging fruit, the people that always managed to get it first.
She's worried that the complicated process to sign up for a vaccine and the need to rely on a car or rideshare puts up roadblocks for many people. Right now, La Maestra Health Center in the heart of City Heights is focusing on vaccinating its own patients. But Chief Medical Officer Javier Rodriguez says that if you're eligible for the vaccine, meaning you're 65 and older or a healthcare worker, it's easy to become a patient at La Maestra and receive one by going to its screening station on Fairmont Avenue. La Maestra has already vaccinated 1,000 people and has also been reaching out to community members to let them know about the vaccine.
As you know, there is a lot of vaccine hesitancy, vaccine resistance. So I think, providing a lot of education, whether it be by either in those phone calls, in the texts that we send, flyers that we've come up with, showing them that they are safe and effective, the vaccines,
Rodriguez also says that the health center is ready to send out its mobile units with the necessary cooling equipment to communities once the state gives the okay. City Heights City Council member Sean Elo Rivera says that the city of San Diego should be opening up more vaccine opportunities in City Heights in the coming weeks, and will lean heavily on community organizations like La Maestra to get the word out about opportunities and overcome years of distrust between the medical establishment and the Black, Latino, immigrant, and indigenous communities.
We have to accept and acknowledge the damage that has been done by the misconduct of government over generations, and as well as the trauma that folks carry with them from their experiences wherever they may have come from. We can't do this effectively without acknowledging that. And once we've made that acknowledgement, then we can actually have a real conversation about what it means to develop and build trust.
But he also stressed that decisions on where to place the first mass vaccination sites were based on where the most cases were being reported, like the South Bay. On Wednesday, the county told KPBS that more vaccine opportunities for City Heights were on the way, but couldn't attach a date, based on still limited vaccine supplies. Max Rivlin-Adler, KPBS News.
The COVID-19 vaccine appears to be safe for pregnant women. Now the National Institutes of Health wants them and breastfeeding moms to be part of more clinical trials. They were not included early on. According to KPBS reporter Claire Tregesser, doctors now say that choice was a mistake.
I panicked. I was like, what have I done? Oh my God, this is a total mistake.
Jennifer Elwell, a nurse at UC San Diego, recalls a scary moment after breastfeeding her 8-month-old son. She had just received her first dose of the COVID-19 vaccine and knew the science behind her decision.
It just seemed like an easy way to help my baby. But yeah, I think initially right afterwards, even before people said anything, I got home, fed the baby, and then I looked at my husband and I was like, should I not have done that?
Doctors and medical experts recommend women who receive the vaccines continue breastfeeding. In fact, the conventional wisdom is that women who get the vaccine likely pass on protective antibodies to the baby through their milk. But Elwell's uncertainty is understandable, given the fact that no clinical trials of COVID-19 vaccines were done on pregnant or breastfeeding women.
Hindsight's 20/20, although we shouldn't use 2020 anymore as an example because that was a horrible year, clearly.
Dr. Lars Borda runs the UC San Diego Mother Milk Infant Center of Research Excellence, which is now studying the impact of the vaccine on breast milk.
The notion was originally to protect women from research when they're in this vulnerable space of either being pregnant or breastfeeding, so that we don't try out any drugs in that space. But really what we should do is we should protect women and their babies by including them in the research to then have data whether it's safe or not.
For the past 6 years, UC San Diego has run a collection center for breast milk called Mommy's Milk that studies the effects of all kinds of things on mother's milk. Dr. CHRISTINA Chambers is the founder and director.
Can the mother, in addition to protecting herself with the vaccine, produce antibodies to the virus that will actually benefit her child as well? So we'll be looking over the course of the vaccine course, and then after that, when those antibodies appear and at what level. And then we'll also look at other things about the milk. Does it, the fat, protein, carbohydrate composition change at all? Is there any difference in milk supply? So are there any indications that the baby has any unusual signs or symptoms?
So far, 1,200 women from across the country who've received a vaccine are shipping Mommy's Milk bags of pumped breast milk, 1 from before the vaccine and 7 more over 2 months after getting the first dose. Answers to questions about the vaccine's impact on the health of babies will take the most time, but the researchers are cautiously optimistic they will find antibodies. They also expect to find that the vaccines do not put anything in breast milk that is harmful to babies. All of these theories are compelling to Dr. Christina Pade, an ER doctor at Rady Children's Hospital and mother of a 6-month-old. She took the vaccine, continues to breastfeed, and is one of the study's participants. As any breastfeeding mother knows, it can feel painful to give up any pumped milk, But Page says it was worth it in this case.
We really are only asking for 1 to 2 ounces with each sample. So I think, it ended up being like 15 to 20 ounces, which in the end is not, not even a day's worth of feed. And so I felt like it was, worth it for science.
That science is what other moms like Carly Keats are waiting for. She is breastfeeding her son and is generally very pro-vaccine, but says it's hard to make a decision without data.
There really isn't actual data yet saying that it doesn't, pass through. And if it does, maybe that's a good thing, maybe it's a bad thing, but there really isn't anything statistically or data driven that's telling me, yes, it's 100% going to be good for you and for your baby.
Keats may have an answer by the time it's her turn for a vaccine, as results from the first 500 women from the UC San Diego study are expected in a few months. Claire Tregesser, KPBS News.
And that's the second half of a two-part series of special reports by Claire Tregesser this week, and you can watch more on our website, kpbs.org. On Friday, the CDC issued new guidance for reopening public schools. It's not a green light to reopen, but it is a more detailed roadmap driven by data and more comprehensive than we've seen in the past. The decision is a local one, but one with national and political implications. Jeremy Diamond has more.
President Biden's pledge to reopen most schools in his first 100 days may be in doubt.
I think it's time for schools to reopen safely.
Teachers' unions are holding firm on demands for new safety measures, and the Biden administration has delivered muddled messaging. But new CDC guidelines anticipated this week could provide a clear way forward.
We've been trying to get unequivocal guidance and the resources since last June. So I think that the guidance from CDC, which this president, unlike the last one, will actually wrap himself around because of the science of it, is going to be a huge step forward.
The new guidance comes amid fresh blowback over comments made by White House Press Secretary Jen Psaki, who suggested Tuesday an open school could mean just 1 day of in-person learning per week.
His goal that he set is to have the majority of schools, so more than 50%, open by day 100 of his presidency. And that means some teaching in classrooms. So at least 1 day a week. Hopefully it's more.
Psaki clarified her statement on Wednesday, but didn't commit to a clear benchmark.
Certainly we are not planning to celebrate at 100 days if we reach that goal. We certainly hope to build from that even at 100 days.
Despite the uncertainty, Chicago brokered a tentative deal with its teachers union to reopen schools for in-person learning. And in New York City, Mayor Bill de Blasio announced middle school students would begin to return to the classroom by the end of the month. The new CDC guidance isn't expected to require teachers be vaccinated, instead focusing on safety measures like masking, hand washing, ventilation, and social distancing.
Safe reopening does not suggest that teachers need to be vaccinated.
The head of the nation's largest teachers union concedes vaccines aren't a precondition for returning to the classroom, but says teachers should be a priority.
What the vaccines do, it is a layer of protection so that essential workers, when you have huge community spread, are protected outside in their communities as well as doing their work.
That was Jeremy Diamond reporting. Here in California, Governor Gavin Newsom says the state legislature is close to taking up a plan to reopen some of the state's public schools. The first phase would include younger elementary school students. Doing so would cost about $6 billion. And local small businesses are also wondering when they'll get to reopen with full capacity. KPBS reporter Matt Hoffman spoke to a local business owner who was able to talk one-on-one with a man making those decisions.
People are being cautious and they're staying home. It just hurts small businesses.
OMAR Ramirez and his family own TOCUMBO Ice Cream, which after 16 years has grown to 3 locations in San Diego, including this one in Barrio Logan.
So we kind of sell tradition. You know, it's a cultural thing. We come from Mexico, and it's traditional to go to the plaza at night and have a drink or have a sundae. There was nothing really like that around here. when we started.
But lately, business has not been good.
Right now, lunchtime should be pretty busy. Tables full, people walking in the door, but it's just not to that point yet.
Ramirez has lost employees during the pandemic and says he and his dad now have to put in long hours.
It's been pretty rough. It's been roller coaster, They tell people they can go out, then they tell them they can't.
Just last week, Ramirez was awarded a $15,000 grant from this state. Then he got a call on Super Bowl Sunday saying the governor was coming the next day.
He got lemonade with chia.
Newsom was in San Diego touring the Petco Park vaccination site before stopping in for the treat with County Supervisor Nora Vargas. Ramirez says he is not a political guy, and the whole encounter was pretty quick, but he did have the governor's ear for a few minutes.
He asked some questions of how we were doing, and I told him, we're having issues with employees, we're having issues with low sales.
Ramirez says Newsom told him he was hoping to increase the state's small business grant fund. So far, more than $500 million has been allocated to businesses impacted by the pandemic.
Hard to keep small businesses when you're not making any sales, but he said he's trying to work on something.
The most recent round of applications for state grants just closed, and officials say business owners should be getting checks within a few days.
It was pretty easy. It was a lot easier than the applications for the federal grants.
Locally, county supervisors voted this week to add an additional $30 million to the San Diego Small Business Relief Fund. That money won't be available until additional federal or state stimulus dollars come in. Matt Hoffman, KPBS News.
Cross-border business is suffering during the pandemic, and advocates say it's important to vaccinate those who regularly enter the United States to work. Max Rivlin-Nadler tells us about the county's approach to vaccinating Mexican citizens.
San Diego County is the workplace for people from both sides of the border. So when it comes to vaccinations, the county isn't worrying about citizenship.
The individuals that live or work in San Diego County, and there are many individuals that live in Tijuana that cross over to work at many of our manufacturing plants, our food processing plants. And those individuals should be vaccinated because they're intermixing with our San Diegans. So the virus doesn't know who's from Tijuana or who's from La Jolla or who's from North County or East County.
Nancy Maldonado is the president of the Chicano Federation. She believes that, like housing, vaccines are a shared resource for the region.
We have to tell the whole story and the whole relationship versus just focusing on, oh gosh, Mexicans or Mexican citizens or, residents are coming over to get the vaccine. The truth is that this is a binational mega region, and it's one of the busiest land ports in the country, and it's a complicated relationship, and we depend on each other for a lot of things, including housing, including healthcare.
Maldonado points out that Tijuana has long been a place where Americans have come to receive healthcare.
The reality is that for years, U.S. citizens have gone to Mexico, have gone to Tijuana for low-cost care, whether it's dentistry, plastic surgery, just for medical care in general, because they don't have health insurance, because they can't afford the cost of healthcare here in the U.S., and they have taxed Mexico's healthcare system for years.
Carlos Gonzalez Gutierrez, the Consul General of Mexico in San Diego, thinks this policy helps many essential workers who live in San Diego without official documentation, and makes the strong case that these essential workers should be given legal status.
If you are an essential worker, you should not be undocumented. And I think that COVID-19 has shown how much this community, society as a whole, depends on foreign workers, a significant portion of whom are undocumented.
Mexico has exhausted its current supply of the first dose of the vaccine, but is expecting more in the middle of the month. The Mexican consulate has already acted as a successful COVID-19 testing site in San Diego, and Consul General Gutierrez hopes that it will be chosen to be a vaccine distribution site in the coming weeks. Max Rivlin-Nadler, KPBS News.
Last year, the San Diego International Jewish Film Festival was able to hold its event in person just before the pandemic hit. But for its 31st year, the festival is moving online. KPBS arts reporter Beth Accomando has this preview.
A man puts on white gloves and carefully opens grimy, decades-old film cans to discover.
C'est un négatif original.
Then, breathlessly, a French film archivist unspools an old motion picture negative.
So who knew people on this planet actually had jobs with white gloves, right?
CHRISTINA Fink is the festival and film programming chair for the San Diego International Jewish Film Festival.
And they take us into their world. They're worlds that I don't know or walk in or even have friends that are involved with. And for those reasons, I love the documentaries like this where I learn something and I'm transported for an hour or so.
Tomorrow, When the Apricots Bloom transports us to 1930s Egypt to introduce us to Jewish brothers who were known as the Egyptian Disneys. The documentary takes you on a delightful journey of discovery as we get to see Egypt's first animated films. You can make a double feature of white-gloved archivists by then watching glass negatives.
This was found as well in the attic?
Yes.
Really?
Yes.
A collection of 2,700 glass plate negatives was recently found in Poland. The photographs were taken between 1914 and 1939. A young woman tries to unravel the mysteries behind these images.
I have to ask some questions. I have to realize, what is this collection? What did anyone ever research it? Do we know who's the photographer? Do we know, like, who are these people? Like, so many questions. And when I started asking those questions, I found out that most of them don't really have answers.
But the film slowly uncovers some answers and provides a glimpse of Polish Jews before their lives were destroyed in World War II. These films represent just 2 of the 36 features and documentaries showcased at this year's San Diego International Jewish Film Festival. Fink says festival goers can buy single tickets rather than a festival pass, with most films available to watch over the next 11 days.
25 out of the 36 are available on demand throughout the entire festival. That is a huge, huge deal to let the viewer control the viewing time.
Attendees can create their own programming blocks, like focusing on World War II, or even more narrowly on just Italy. So Holy Silence, about the Vatican's response to anti-Semitism, is complemented by Syndrome K, about Italian doctors who invented a fake disease in order to hide Jews in their hospital.
The historians and the scholars are still uncovering a lot of World War II history. You'd think we would know it all by this time, but that is not the case.
Shared Legacies, the African American Jewish Civil Rights Alliance, will only be available for a 48-hour window.
The Jewish people have the DNA in their soul to look up close to what happened to African Americans after slavery.
It looks at the close connections between Jews and African Americans from the 1909 founding of the NAACP through the Civil Rights Movement of the 1960s. Many films will have discussions online or filmmakers' introductions to provide additional exclusive content for festival goers. Beth Accomando, KPBS News.
San Diego's large Asian American community is celebrating the Lunar New Year this weekend. There is optimism for a better year ahead. But as Christy Lustout reports from Hong Kong, the economic toll of the pandemic is lingering.
It's usually a time of raucous joy in Hong Kong.
This is the first night of the Lunar New Year here in Hong Kong, and huge crowds are lining the streets.
There's an annual night parade with dragon dancers and costume performers, fireworks over Victoria Harbor, and huge social gatherings. All these traditions are on hold as Hong Kong continues to battle a 4th wave of infection, which has brought parts of the city under lockdown for the first time in the pandemic. And orchids, a popular tradition for Lunar New Year decorating and gifting, have become harder to sell amid the pandemic.
There was no business at the florists, meaning distributors like us won't have business as well. 60% of our business has been impacted before the Lunar New Year.
In his trade, Yong is known as the Orchid King. He says Lunar New Year fairs are usually the biggest source of income for flower farmers, but not this year.
To minimize infection, the Hong Kong government canceled the fairs and then allowed them to run at a reduced scale. The U-turn caused confusion for flower vendors in Hong Kong, including Young, who expects to lose some $300,000.
The virus has also dimmed the spark here, but a few rituals do go on, like the burning of incense and the shaking of fortune sticks at Wang Tai-sin Temple ahead of the Lunar New Year. This Lunar New Year, the temple won't be hosting the annual first incense offering for throngs of worshippers. Instead, it plans to live stream a ceremony for the public to pray at home.
We came here last New Year's Eve as well, so that's why today we're here to show thanks for the blessings. If it's going to be live streamed,
we will pray at home then.
Today at the temple, Jennifer and Sean offer incense for good health and pray for the pandemic to end soon. Back in the north of Hong Kong, the Orchid King surveys a strip of his 7,000 square foot farm and considers the future.
The longer the pandemic is, the more miserable we are. If we cannot do business at the markets, we will be really miserable.
He hopes more people will go to him directly to buy his flowers. Otherwise, this symbol of abundance will be left unsold. Hardly an auspicious start to a new year. Christy Lu Stout, CNN, Hong Kong.
And a reminder that you can find all of our content on the Tracking COVID-19 page at kpbs.org. In addition to our reporter stories, we are updating our live blog with the latest news and case numbers. And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and from all of us here at KPBS, thank you for joining us and stay safe.